If you want to strengthen your skills in injury prevention screening as a sports physical therapist, you have to tune into this episode. Hi, everyone. Welcome back to the podcast. Welcome all new listeners, and welcome back to those who have heard my content in the past. If you want to strengthen your skills in injury prevention screening as a sports physical therapist, you have to tune into this episode. Before I go in to the podcast details, what is new? What is better in life? At the time of this recording, it is the day after or right after the holidays and Christmas. And I am coming off a big high, good time with the family, and as all of you listening, everyone has a different experience during the holidays and Christmas. And for me, this was a big one. It's monumental, and I'll explain why. Um, the house, for the first time ever, my wife and I, we like to celebrate with her family. So this is our first time with my family, and it's a pretty big deal. And it was a full house, and there were a ton of people, and I got a little emotional, I have to admit. The first time that my kids have opened Christmas gifts in our house, and I think for me it was that was a big deal to me because I remember growing up. I remember we our family. I think there's still don't think I'm crazy here. There's about 70 within like a 10-mile radius of here in San Diego with all my family. And so you can imagine one household with that many people. It's chaos, absolute chaos. And I love that. And so it was just the start of that at our house. And so that for me was a really big deal. So that was great. My kids got bikes. I'm excited to see them grow without training wheels. My wife got the full house. That's what she wanted. She wanted to literally have a house full of people, and that was it. For me, it was just watching everybody open up gifts. Fun fact about me, I'm usually the last to eat, the last to open, the last to do anything because I want to live in the moment, and I just want to watch people embrace it, whether that's a holiday party or gift giving, whatever it is. I like to be the last one just so I can enjoy the whole thing. So, all right, on to this podcast. Why are we doing injury prevention screening? All right, so as many of you know, I'm hosting my Sports PT Kickstarter in the next couple of weeks, and I'm getting all the surveys from all the attendees, like what do they want to hear, what do you want me to like spend more energy, what's your area of improvement or your weaknesses, where can I help? And the topic of injury prevention has been a big deal. And although a lot of physical therapists say they want to do it, like this is like the next step for me, like I want to be able to include it. They're like, I don't know how, what do I do? Do I just like do some normal like movement screens? Like what's the best way for me to do that? So I wanted to address that. So for those of you on the Sports PT Kickstarter and you're listening to this, great, like you're just getting a little kickstart on this, little head start. But we'll go into full depth into like the actual screens and going through the whole process on the course. For those of you listening today, I'm going to go through literally what an injury prevention screen would look like, how often, what would I do, how I've implemented it, and the story of how I came to my big test, my big, I don't know, 12 or 14 tests along the journey. I'll tell you a story about that. But yeah, that's why we're doing this one. And for those listeners out there, I know that a lot of you are on different parts of the journey. Some of you are new grads, some of you are established clinicians, and you're just trying to like refine your skills, add more things to your toolbox. Or some of you are looking for like inspiration or like what's the next step for me. So this will help put you in the right direction wherever you are. All right. All right. So why is injury prevention screening so important for the sports PT? Like why? There's a lot of layers on this, but I'll tell you the truth. I'm going to speak my mind here. I think that physical therapists I think we're great. I think we're fantastic. I think we have a purpose or a role in healthcare, and I think it's fantastic. However, I'm going to give you an analogy, and for some of you, you can see my side, but others are going to be like, I don't know if that's real. But no matter what, you have to understand we are in a hamster wheel of pain. Let me describe that. I don't like to be in a hamster wheel doing the same thing all day, every day. I like to make sure that I'm progressing and those around me are, including the patients I serve, the athletes I serve, my team members, everybody. I like to keep pushing. So if you think about this, right? I'm gonna give you an example here of, do you know any friends of yours, family, maybe you, who has debt? And it could be student debt, it could be car debt, it could be a home loan, it could be credit cards. All of us at some point will face debt. Now, how fast we get out of that is a whole different story, right? For some of us, it was school debt. For some of us, it's a home debt, whatever that is. And some of you are taking, car payments. You have like a year or two, whatever that is. Now, have you ever met anybody who was in debt and just kept getting in debt, right? I know personally people who have, like, they got credit card debt, right? So they have 6 to 8 thousand. They pay it over time, and they're like, "Oh, finally done." And then life happens again, and then they have to borrow another credit card and put it on the credit card, and they can't pay it off. It's because they couldn't plan accordingly, or life just hit them, or they have a challenge with spending, right? Like some people just have a challenge with spending. And if you've ever done this and you've seen people, you're like, just stop doing that, or like, stop gambling, stop buying clothes, stop doing the thing that's putting you into debt. And some people have a hard time doing that, right? But you get it from the outside. You're like, just stop. If this sounds like you, at some point you got to get out of debt. You got to stop like doing the thing. I understand life does hit you. I'm just saying for repeated people who are constantly in debt, you try and help them, but they have to see the light at the end of the tunnel and they have to find out what the main solution is to get them out of debt. Now, as a debt collector, somebody who's like collecting debt on all these individuals, they're like, at some point you got to figure this out. They're like looking at them, just shaking their head. They're like, I'm calling you again, Mr. Jones. We need to collect on this debt. All right. So how does this relate to PT? You ever met somebody who just can't get out of pain? They just like, they come to you and they're like, oh, 5 sessions, 12 sessions. You're now no more knee pain. And then they're like, I don't know, 2 months later, oh, my neck. And you're like, I'll clear that up for you. But at some point, you got to stop doing CrossFit, F45, powerlifting, whatever it is at the volume that you're doing or intensity. You're going to have to learn how to train. And they come back with back pain 6 months later. You're like, here we go again, Mr. Jones. I've been telling you, you got to move, you got to stretch, you got to warm up, you got to do all your exercise, blah, blah, blah. And they're like, yeah, whatever. Just help me get out of debt, basically, is what they're asking you. And you're like, all right. A year later, they're like, oh, my elbow, I've been doing a lot more tennis. I just started playing and I just went all out and I didn't even practice. I just warmed up. You're like, Mr. Jones, I've been telling you to get out of pain. You have to be able to do all these other things. And when you manage things like that, yeah, you're a skilled clinician. Your job is to get people out of pain, right? Like that's at the superficial level. That's why people come to see you. And that hurts me. That hurts me a lot to be a band-aid. As a clinician, I don't want to be a band-aid. I want to be like a long-term solution to something. Uh, it brings me joy. It brings me a lot more value, like to my life fulfillment, because I know I can actually make a huge impact on somebody's life versus a superficial band-aid. Like, yep, I got you out of pain. I know I'm going to see you in 6 months, Mr. Jones. I know you can't pay your credit card and you're going to continue to have problems, but I'll be the person to come save you. And now, for some of you, you're like, I'm totally into that. I think that's great. For the ones who want to challenge the norm a little, here's the thing I have. I personally think physical therapists can be fantastic healthcare providers. Now, what's the difference? A healthcare provider literally can manage multiple facets of healthcare. And I was first introduced to this at the United States Olympic Training Center, where I worked as a healthcare provider. That was my title. And ultimately, what I learned was I had a skill set, get people out of pain. But in pro sports, pain is like you went too far and it's looked frowned upon if you have pain. Why? Because you have all year to plan. And if you're in pain, it's because your whole team of healthcare professionals couldn't get you to where you wanted or couldn't maintain you. And to me, it was a punch to the gut when somebody had pain in the middle of the season. I was like, oh, where did I go wrong? What happened? How did you develop this? I thought we did this right. And for some of you who've never seen that before and you're in an orthopedic clinic, let me tell you, when you're in pro sports and you can manage people preventatively and finally be able to like prevent pain, it is magical. And you're like, if I see pain that went too far, I did a bad job. But when you're in an orthopedic clinic, you're like, but that's what I serve. and there's like no injury prevention, there's no education beforehand, no accountability. You're just like fixing people's debt, like short term, like like a hamster wheel. And I think that there's another element for us as clinicians that we can, I think we can do a larger impact on our communities if we can understand injury prevention. Now, how do you get there is the next thing, right? So you get somebody who's in pain and they're pain free now after 10, 12, whatever sessions, however it takes you long, or 2 sessions. But your next goal is how do you transition them to injury prevention and pain prevention, right? And that's the hardest part, right? Like you're like, okay, great. I want to do it. Everybody professes it. All the courses I've taken say injury prevention is key. The profession is saying this, but there is zero education on injury prevention. How do you do it? Like what's the next step? How do you create the programs? What is it that I need to do? And that to me is where that's why I've created my personal courses, because I was like, where's the gaps? Like, why can't we do this as a profession? Because it doesn't exist. Like, we don't see this. And I've been very fortunate to work in pro sports, and that gave me just a different framework. I'm like, I want to change the planet because I think PTs can take it to a different element. I think we can take it to a healthcare provider, but that means everybody has to be on the same page, and that means you have to be able to communicate with people in your community and how you're going to bring them value and what other things they're going to do. So injury prevention, I think, is the long-term goal for us as a profession. If you ask me what's our bread and butter moving down the line, injury prevention. Why? If you don't know, if you haven't heard any of my previous podcasts, I think we're good at movement. I don't think that's like our bread and butter, but our profession sells it. I'm in California, so the California Physical Therapy Association, I think our slogan is like PTs improve the way you move. It's hard to improve the way you move when you're in pain. Now, think about movement, right? Like I think there's been studies on, different animals or apes or monkeys, whatever it is, like to learn new habits, like 10,000 reps, right? So like think about this. If you're in pain, that movement is not reflective of your actual movement, right? They're using that as compensation, right? So say you get them out of pain, and for some of you it's 2 visits, some of you 10 visits or 12 visits, right? And we want to be like autonomous, like we want to create the patient and athlete who can be autonomous. The problem is once you get them out of pain, when do you get the reps to teach them what good quality movement is? So say they're out of pain in visit 12. Well, what's insurance or other people going to say? Like, you're cut off, you're done, like you can do all this. So then when do you get the chance to improve people's movement? Like truly have an impact on their movement? You don't. Because if it's going to take 10,000 reps, how are you going to help them if they're done and discharged? Well, what if I improve their movement leading up to the pain? That's great. But you probably got what, like, I don't know, 30 repetitions of total great movement. How are you going to change that for the long term? So at some point, there's an end destination that we want to get to that requires 10,000 reps. It doesn't mean that we have to see that patient or athlete 50 times in between there. It just means that we have to check in to make sure that movement's doing great. And I think that's where injury prevention, screening, or checkups are great for people. And I know we advocate as a profession, but no one is offering courses on how to do it. And so my big goal, my vision is to be able to set that framework and help clinicians become a healthcare provider, become something different, not just stuck in the hamster wheel of getting people out of debt, got you out of pain. I know you're going to be back in 4 months. I know you're going to be back. Like that's, I think there's value to that. I think we like it impacts people's lives. I get it. But if you're like, how do I take my career, my profession to the next level? It's push in the direction that we're advocating and we have access to, but don't just say it, do it. And that's the hardest part. And if you went to, wherever you work, hospital, large company, small company, whatever it is, and you said, hey, listen, I want to do an injury prevention, no one would bark at that. I think it'd be a great idea. The next step is who's going to do it? How are we doing it? Blah, blah. So I'll go through a couple of fundamentals in here, but understand that's my framework. That's where my head's at. That's why I think injury prevention is so big, is because it gets us out of the framework of being like debt collectors or like just short-term pain management. And if you really want to have an impact and it's going to take you 10,000 reps to clean up somebody's movement, you better believe it's not going to be while they're in pain, because that's modified movement. That's not real movement. And after they're out of pain, you don't have that much time until they're discharged or they're gone or whatever it is. So now you have an element of how do I improve their quality of movement over time? That's the injury prevention side. And I think most people are looking for that. They just don't know it. I think a lot of consumers, patients and athletes, they know Generally what that is, if they're on Instagram, if they're on YouTube, they're progressive, they're, they're the well-informed patient and athlete. I've done a podcast on that. And so this is, I think, where we're headed. So let me tell you what that looks like. That's the current problem that we're having with what we want out of injury prevention, but now what's the solution? How do we get out of that? So with that, here's a couple ideas I have for you. And uh, the key here is to, let's take it from the person who is about to be discharged or is near pain-free. The first thing we have to do is inform people of this, because let's always assume that they don't know. And I think that's very important for clinicians to understand. Always assume they don't know, but speak to them like sixth graders who um, maybe have some information, but like speak to them like they don't know anything, simplify it for them. And literally, the conversation I'm having with you right now is literally the conversation you can have with people. Like, I understand you're totally out of pain, but the next step for you is to stay away from pain. And if we want to do that, that's going to take, 10,000 reps to be able to do and really lock in your running form and everything else. Now, it's going to take months to I don't know, a year to be able to do that. So what I'm going to do is I'm going to do an injury prevention screen on you. You're going to identify all the impairments. Now that they're out of pain, this is the perfect time to look at actual quality of movement. So now we're going to identify all the existing impairments that you haven't been able to clean up. So by discharge, assume like you did 6, 12, 18, 24 visits, whatever that was. You've identified all their impairments, you've fixed those. Now, when they're pain-free, now you have still existing impairments. If somebody doesn't have an impairment, uh, good luck. I don't know if anybody walks around with just like pristine movement, beautiful range of motion. If you do, it's like a small outlier. Don't rely on them. There's a lot more people out there. So identify it, do your normal screening, whatever that is, and the next step is to address them. So when you look at a home program. This is not a home exercise program. A home exercise program I view as 1 to 3 exercises max to address a specific list of impairments. So you pick your top 2 impairments, give 1 or 2 exercises, and that's it. It should have a trickle effect. You fix the top 2 impairments, everything else should get better. So if someone's, having pain with like, I don't know, squatting, you fix their ankle, their low back might get better. You fix their ankle, their shoulder, their neck might get better. You fix their hip mobility, their back, ankle, and everything else might get better. So you have to figure out your top 2 impairments and have the trickle effect that once you address this, it'll help them long term. That's a home exercise program to correct impairments, specific impairments. Now, a strength program is very different. A strength program, if you ever heard any of my podcasts on these things, a strength program is going to have 1 to 3 foundational movements and 2 to 3 accessory work exercises that for a total of 50 minutes max, including a 5-10 minute warm up, 5-10 minute cool down, and actually 45-50 minutes of actual work. So when you do a program like that's a strength program. So you have to decide, what are you working on right now? Are you just doing the list of impairments that you think over time that's going to help this person? Or do you need create a strength program to help them develop more foundational work on their body? That's a whole different program. So you have to decide what you're going to do here. So is this injury prevention? I think strength development and all those things can also be considered in injury prevention, especially if this person's brand new to the world of that. They've never strength trained before. They just wanted to be a runner and they decided to run and they had no base strength, no hip strength, no, like they had knee valgus, the ankles are all over the place. They have poor running form. And you say, okay, great, we're out of pain. However, you got a lot of work to do. And you're going to say, you know what? I think we need to just get you strong before we start actually just working on small impairments. I think you need a base level of strength to actually improve your ground contact time, improve your stride length, and get you decreased times. I think that'll help you more than just working on knee valgus movement correction. You have to understand whatever framework you're coming from, you have to see what's the biggest like common denominator that you're actually going to make the most impact with. Is it true like foundational work, or is it just qualified movement? And the way I would show you this is that whenever you're working with somebody and they have some base level of fitness, and on the spectrum of a bell curve, if they're far to the right, they're very advanced exercisers and they know what to do, great. You only have to do a base level of impairment-based exercises because they're fine-tuned, they exercise a lot. You don't have to address much. Somebody on the far left side of the curve who's never exercised, doesn't have anything, that person just needs to get strong and move more. Somewhere in between is most of the population. 80% of the population falls within, they exercise 3 to 5 times a week. They need a little bit of strength, a little bit of movement, and that's where your injury prevention program or your screen or whatever needs to address. And the qualifying event on all of this is that you have to continue working on prevention, meaning you give somebody a home program. All of you are guilty of this, right? So what if I gave you a home program right now, how religious would you be about it? Like how good would you be about it? Probably take you 4 to 6 weeks before you're like, I'm onto something new. And the reality is that's just human nature. That's why I think people have to come in and check in because they just lose motivation. They just lose sight of like what the priorities are. And truly, that's all you need to do is just do, I don't know, whatever. It could be 3 months, whatever it is. But ultimately, you just have to have a list of things that people are working on, identify them, assess them, address them, and then continue preventing them. So this can all start with an annual injury prevention screen. So for some of you get somebody out of pain, this is the first step. All right, this is the first step right now. It's an annual screen, and then I'm going to see you every 3 months with a quarterly checkup. And what that allows you to do is just check in, like how bad were you about it? How much are you running? Well, I fell off of this. I didn't do this. Great. What do we need to do to address it? I want something in the gym. Perfect. We just address that. Now, if you don't do this, if you don't have annual injury prevention screens with quarterly checkups or quarterly check-ins, whatever you want to call it, you will be a hamster wheel specialist, just working on pain, 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 pain. Nothing wrong with that. However, when you look at athletes, you know they're going to keep pushing the limit. You know they're going to keep doing more. You know they're going to try a different sport. They're going to go from pickleball to running to mountain climbing to what their interests are going to change. And because of that, if you're just preventing knee pain with mountain climbing, that knee pain will be very different than running. And that will be very different than tennis. That will be very different than softball. All those knee pains are addressed differently. So you can't assume just because you fix one knee pain, it's going to, transfer all to all their activities of daily living and all their activities. It just, it's not possible. And they don't see it that way. They're literally going to be like, well, I had knee pain with walking, but now I have knee pain with running. Can you check it out? They literally think it's different, and you have to help the help consumer. You don't tell them, not all knee pain is created equal. What you have to understand is what's the context, what was the volume, what's the intensity, what's their base level of strength, what's their flexibility, and you have to look at those variables every single type of activity that they try or they address. So with this, I think you have to understand when you get them out of pain, that's just the start to the next level of what they're trying to do. That is the next level of you being able to help them. And that to me is a true healthcare provider. A physical therapist, great. We will do movement, we will do pain all day. But what profession addresses beyond pain? Whose specialty is that? If physical therapists like work on pain and movement, maybe massage therapists work on soft tissue and movement, and maybe chiropractors do nervous system, movement, pain. Like everyone has a domain, right? A nutritionist does this, an acupuncturist does this, corrective exercise specialist does this. Who helps people beyond pain? Strength coaches, strength coaches, technical coaches, people who are trying to advance them in different levels. So besides strength coaches and technical coaches, there's not a lot of people advancing people out of the hole. Meaning like they got them pain free, but they still have this gap between like where their base level fitness was or wherever they was. Like maybe a running coach can get them back to where they were. I think healthcare professionals and physical therapists, healthcare providers can help people get to that next level, even though you're not a strength coach or a technical coach, you have the knowledge on how to get somebody strong. What if they're not working with a technical coach? What if they don't even know a good strength coach or trainer in their area? So you can still be a resource to help fill that gap of, well, listen, we can get you a strength program. I'll work on a couple of corrective exercises. You work on this for the next 3 months. We'll adapt it. We'll go into a general preparation phase. We'll go into hypertrophy. We'll go into general strength. We'll go into, okay, now you're going to do train for a marathon. Now, I can help. I don't know how to run. Like, I don't know running mechanics, but I do know how to like work on a general running program. the problem is you can't have that conversation if they're out of pain and out of the office. So how do you fix that? You have that conversation and help people understand the value you can bring them is beyond the hamster wheel, is beyond pain, and get them to the next level. And for some of you working in different offices, you think, wow, this is actually possible. I can totally do this. But the problem is you can't communicate it because you know why? Most physical therapists, they will communicate this way. Ready? Mrs. Jones, your left lateral heel is having issues because it continues to have a lateral or medial collapse every time you have a heel strike and going into a midfoot strike. And now we have to change your shoe wear. See, you see this heel counter? It's a little too stiff. What we're going to do is we're going to put this lateral wedge to put you into a medial collapse into this, and now your hip doesn't go into valgus. The patient athlete's like completely lost. They're like, you just spoke Chinese to me. I don't understand that. I'm gonna let you do it. But the problem is if they can't understand it, they don't know what the next step is. And so for you as a clinician, you gotta simplify that. I always tell people, speak to me as if I was a sixth grader, right? Your heel hurts because you have limited mobility or limited motion here. You're weak in the hips and you just need to get stronger so you can have less time on the ground and faster speed. That will increase your running speed. How does that sound to you, Miss Jones? That's perfect. People can understand that context. They can't understand PT jargon. And so the challenge you will have is if you're stuck in the hamster wheel of pain, you'll never get out. If you use PT jargon, you'll never be able to help somebody beyond that pain. So there's a lot of things that you have to be able to do, and I think communication is a big one. But I think you also have to understand what's the next step for them. So in an injury prevention screen, some of the big things that I do is I'll do a normal movement assessment. Like I'm a big fan of the functional movement screen, the FMS. I think it's so easy, it's so simple. It's not the end all be all, but it's super easy. And I think once you learn it, I think it's like takes me about 3 to 4 minutes to complete. So that's great, efficient. And then I'll do a selective functional movement assessment, SFMA. That's 7 tests. That'll take me an extra 2 minutes. So within 5 minutes, I have a true mobility screen and I have a little bit more of a movement screen. Combine those two. Now all I'll add in is base level of strength tests, right? So look at your biggest impairments, look at manual muscle testing, everything else. If they're a barbell athlete, I'll put them through a barbell screen. If you haven't taken my barbell course, that'll take you 3 minutes. So all the screens have to do, they don't have to be magical. If you're a type A 3.9 sports PT, I totally get it. You want to look paralysis by analysis. You want to look at every single movement. Like, what is it? Is it like, is knee translating a little too far? Is it 4 inches on the, dorsiflexion test, or is that 3.7? It doesn't matter. It just needs to be a gross limitation. And the injury prevention screen should be fast, should be done in probably 10, 15 minutes. If you're going to do an hour of injury prevention screen, you're going to do 10, 15 minutes of the actual screen, and they should be quick and easy, quick and dirty. The next 10 to 15 minutes is just going to be exercises to address it, run through everything that they would need. And then the last 10, 15 minutes is really just running through, like communicating, here's the program, here's how many days, here's the parameters, and then 5 minutes of here's what's next. I'm going to see you in blah, blah, blah. That is a foundational program on how to help people with injury prevention screens. So if you're asking me what's the priority in an injury prevention screen, I think they have to have a base level of strength. So you got to assess that, whatever that is relative to them, right? Whether it's shoulder pain or knee pain, whatever it is, base level strength that you feel is adequate. I like squats, I like deadlifts, I like any form of pressing. Mobility tests, a functional movement screen, selection functional movement assessment, a movement quality screen, whatever that is for you, whether that's like a step down test or I don't know, whatever it is that you want. Plyometrics that can be linear or vertical or lateral, depending on their sport. So that can be a hop test, it can be a broad jump test, it can be a single leg triple hop test, whatever it is that is relative to their sport. And then you have to figure out, so once you do that and you bring them back, the reason why most people get hurt atraumatically is you can also look at the acute to chronic workload ratio. The problem is they go in too hard too soon in an activity. So anytime that I work with somebody, I'm trying to figure out what their acute to chronic workload ratio is. You can Google this and figure this out. I'll do a whole podcast on it. But ultimately, I just need to know how fast you went into this. And your percent improvements need to be in around the 20 to 30% range is your progressions. And if you go more than 10%, it puts you at risk. And so that makes sense to you, right? Like if you're a runner and you increase mileage by 50%, that's a lot every single week. That's not possible to sustain it. You're going to get hurt. So when you have these cross country runners, like high school kids who are cross country runners and they did nothing for a summer, and then they go into like cross country running within like 2 weeks and they increase their mileage, you went from zero activity to like 300%. The acute to chronic workload ratio is too high, and that tells you immediately that they're at high risk for injury. You combine that with good movement tests, strength tests, you can now forecast where people are going to get hurt. That's crazy. And that's what we did in the pros. One of my jobs as a physical therapist, I was the first physical therapist to be hired at the Chula Vista Olympic Training Center, and the single credential. There was a PTATC there as well, but I was the first physical therapist, and my job was to look at where the gaps are and where we can keep people healthy all year long. So I created tests, and I created a battery of like 1 or 2 days of looking at injury prevention screens, and then now do checkups every quarter and then forecast and look at data and where would athletes get hurt, and it's very predictable. So as long as you looked at acute to chronic workload ratio and you knew their best level strength and mobility deficits, you knew in the season where they're going to go. So all that did was it helped me communicate with the strength coaches and the technical coaches. Hey, something comes down the pipeline. I would do is I'd either drop down your volume or intensity depending on the time of season, and I would modify your intensities on the track. So you then have to work as a team to look at push and pull on total workload for an athlete. And that to me is where we can make the most impact. Now, some of you don't live in rural areas or areas where you don't know anybody. You don't have to be the strength coach. You don't have to. I'm just giving you more insight into how you can maximize your professional development in looking at injury prevention screening as a sports PT, so you can increase your toolbox to help the people. Now, some of your patients athletes might be only 10 to 20%, but it doesn't matter. It's the 10 to 20% who also know other athletes who you might be able to help. So it opens your window. I think ultimately you're always looking for something how you can help people more. Like that's just the nature of sports PTs, like 3.9 type A personalities, that they want to be able to do more. So if you're looking for something different and you want to challenge the norm, this is a new one for you, injury prevention screening. So for me, if you can do this, it's based on two things: that you can educate somebody on it, which means that you got to be able to communicate, not like PT jargon, but like a normal sixth grade, like a human, not knee valgus of the lateral, minimus and the blah, blah, blah. The outside of your hip hurts because your knees aren't moving great. One of the things we're going to do is correct that form and get you stronger. Sounds good. Simplify it, 30 seconds. You got to educate people on what it is. The next is you have to check in on those next 10,000 reps. So help people stay accountable to those 10,000 reps. Let me double check. How's that running form? Blah, blah, blah. And maybe some people you don't need to come into the office. Maybe they just can do some video check-ins and you can do a virtual. For some people, that's like very appealing. So either way, you're creating more opportunities for you as a sports PT to help your local community. And that to me is like where we're going as a profession. I really think that we can do more. And if that fires you up and like you're like, Chris, what else can I do? There's other elements. So if I can break down my entire like visual map of where we can specialize. You have heard maybe different podcasts on my topics, but I think strength and conditioning, I think we can have a huge element there. I think the injury prevention side, I think the sports PT side, I think the acute injury management side. And when you put that together, it's a beautiful combination. And that's how I help my team, CPT and sports PT. And I really want to help you be able to do the same. And that really does fire you up. That's why I built my first course starting the year, my entry level course. That's my Sports PT Kickstarter. And that's literally hitting all 4 domains over 8 weeks. That's 2 hours every single Wednesday night from 5 to 7 at night, 8 weeks of that. And just getting you to understand content. Why? Because I know that it takes education and it's going to take regular accountability and 10,000 reps. That's why I built this Kickstarter course literally so I can follow the same timeline that we're working on with injury prevention screening, is that education over time allows for better clinical reasoning. And that's why I built the course. So for those of you interested and you're like, man, I can't do Wednesday, it doesn't matter. It's going to be recorded. You can watch the modules afterwards. There's a group where you can put all your information in. You have weekly assignments. That's literally why I started the course. And ultimately, this podcast was about injury prevention screening for the sports PT. Get started on that first. Get lost. Figure out your next, challenges or speed bumps. You're like, oh, I didn't know that I can do this, or what test should I do here? It doesn't matter. You just have to get moving and help your community do more by offering something that you already are good at. It's just they don't know it exists, and that is where I think the next step as sports PTs are. So wherever you are on this planet and you're listening, I hope that gets you excited because it is the next generation. It is sports PTs 2.0. And I'm excited to see you. For those of you who have registered for my sports PT Kickstarter, I think it's gonna be a fantastic course for you. It'll help take your skills and your reasoning to a different level. I think that's what you're looking for. You can always learn more and more like little exercises and things like that anywhere you want. But ultimately, how do you put it all together? That's what this course is about. So, all right. For those of you not joining, I will see you on the next episode. Take care, guys. See ya.